All right, it's Tuesday, and it's good to be back with you, people. It's BT Vancouver, 7:46. We're going to bring in our good friend, Dr. Yvette Lu, right now, because it is upon us, the time for seasonal allergies. Good morning to you.
Good morning.
And we're wondering today the difference between allergy symptoms and COVID-19 symptoms. Before we get to that, though, Dr. Lu, just set it up for us. What exactly are seasonal allergies?
Seasonal allergies, also known as hay fever, are allergies that we can get actually year-round, even though they're called seasonal allergies. In the spring, we see allergies to trees. In the summer, we see allergies more to grasses. In late summer and fall, we see allergies to weeds. And year-round, we can see allergies to insects like dust mites, to molds, and to animals. So we can get them year-round, and they cause symptoms in the respiratory system, which is why we can sometimes confuse them with COVID-19. Okay. Which is a respiratory virus.
Yeah, now let's break down some of those common symptoms you may get when you're suffering from seasonal allergies.
Yes, so you can get symptoms in the respiratory system, as I said. So runny nose, stuffy nose, sore throat, coughing, sneezing, itchy throat. You can also get runny and watery eyes. You can get a headache. You can get fatigue, difficulty concentrating. In children, you can sometimes see them having difficulty with schoolwork or difficulty with sports. They also do some mouth breathing, throat clearing, and rubbing of their nose.
And you got to keep your hands away from your face these days. So that is kind of where we get into the issue right now with public perception and when people see you out there and you've got these kind of symptoms. So how do you tell the difference between those seasonal allergy symptoms and someone who may be having symptoms from COVID-19 related problems?
So people who get seasonal allergies often get them every year. So if your symptoms seem exactly the same as last year, and if they respond to allergy medications like antihistamines, then most likely they're seasonal allergies. The top three symptoms of COVID, the most common symptoms of COVID, are fever, shortness of breath, and cough. So you won't get a fever with allergies. If you have a fever, you most likely have an infection. Sometimes with a fever, you can also get muscle pains all over your body and feeling tired. You won't get the muscle pains. It's unlikely to get those with allergies. So fever and muscle pains, it's an infection. You need to go see your doctor. With a cough, you can get that, and shortness of breath. You can get that with allergies, especially if you have asthma. But the cough in COVID-19 tends to be a dry cough, and the cough with allergies tends to be a wetter cough because it's caused by postnasal drip, which is when you get nasal congestion and it drips down the back of your throat and irritates your throat. You can also get,
Interesting.
So you can get watery eyes with allergies, and that tends to be both eyes, whereas you can get a viral pink eye with COVID-19, but that tends to just be in one eye. As opposed to both.
Very interesting distinctions there. And as we close it out, we see all these products on the shelves in the drugstores that help you manage allergies. Talk to us a bit about those and other ways that you can help deal with them.
Yes, so antihistamines are a good way to deal with allergies. There's different types. There's drowsy and non-drowsy. So if you're taking them in the morning, you want to take a non-drowsy one or you'll be tired all day and groggy. And then other things you can do are to reduce your exposure to allergens. So if you want to stay inside as much as possible, close all your doors and windows. If you're in the car, close your windows, use the recirculate function in your car, and you can get an air filter for your home. When you get home, take off your hat and coat and shoes and leave them at the door so you're not trapping allergens all over the house. Wipe down your pet, and then you want to shower daily, especially before bed, and wash your hair daily to keep the allergens out of your bed. Oh man, great tips as always. Dr. Lu, we have to leave it there for time. Thank you so much. Thank you. All right, that's Dr. Yvette Lu, family physician, with the differences between seasonal allergy symptoms and COVID-19. Coming up.